Thank you so much for joining us today. My name is Madeline Frigo, and I'm the staff liaison to the NSGC J.E.D.I Stewardship Committee. I want to thank today's presenters, including Carrie Haverty, NSGC's board liaison to the J.E.D.I Stewardship Committee, and the team at the Exeter group, who we'll be introducing shortly, for being with us today and sharing the high-level findings and recommendations from NSGC's 2024 J.E.D.I organizational assessment. A copy of the 2024 executive summary is now available on nsgc.org on the J.E.D.I resources page. If you would like to refer to it during today's presentation, you can go to nsgc.org/J.E.D.I and click resources at the top of the page, and you'll see a link to the 2024 executive summary, and I'll drop it in the chat as well. Next slide, please. Just a few reminders for today's webinar. As a courtesy to our presenters, all attendees have been muted. Please utilize the Zoom Q&A box for questions that you may have throughout the presentation. The chat function is also available for discussion throughout the talk. We will be answering questions live during the last 10 to 15 minutes of the webinar. During the Q&A portion, I'll be monitoring the Q&A box, and if for some reason we can't get to all the questions today, we can send out written responses afterwards to those questions. Okay, I will now pass it off to Audra Davis, Managing Partner at the Exeter Group, to introduce today's webinar agenda and presenters. Audra?
Thank you, Madeline. Again, I'm Audra Davis from the Exeter Group. For those of you who don't know us, we are a healthcare equity consulting firm based in Chicago, and we support healthcare delivery and healthcare adjacent organizations along their health equity, DEI, J.E.D.I journey. We have been around for about 25 years and really appreciate the partnership we have formed with NSGC for the past 4+ years now. Today, we have a packed agenda, have a lot of information to share with you. We will start with the methodology for the assessment. We'll talk about some of the strengths that we found. We'll dive into the findings from a qualitative and a quantitative lens. We will also share with you a maturity model that we created to help our clients see where they are. We will end with the top 3 recommendations from the assessment and then talk about next steps before opening up for questions. You'll hear from several different voices today and see different presenters. To the last 3 faces to the right, these Exeter team members will be sharing the findings with you. Lisa Burton leads all of our engagements for Exeter. Yamna Quadri was the project manager on the engagement, and then Kaeleigh Borcia was one of the analysts who worked on the engagement. And now I'll turn it over to Carrie Haverty, who is a member of the board and the board liaison to the J.E.D.I Stewardship Committee.
Thanks, Audra. Thanks for being here to all the attendees, and thanks to Madeline for organizing all of this as always. So as a reminder, earlier this year, NSGC partnered with the Exeter Group to conduct a J.E.D.I organizational assessment of NSGC to help us gain deeper understanding of our strengths, areas of opportunities, how we can continue to grow a more diverse and inclusive organization for NSGC members in alignment with our strategic plan. This was a follow-up to the 2020 survey that many members may remember that was done and reported out on and initiated our J.E.D.I action plan, which we've been working on for the last 4 years. And the summaries of both the 2020 and the 2024 assessment, as Madeline mentioned, are available on the website, nsgc.org, and the link is in the chat. So you can also see there is a dashboard that shows you up-to-date information on our progress for that J.E.D.I action plan that came out of the 2020 assessment. So this year's assessment was sent to all NSGC members. It also included 15 interviews with key stakeholders consisting of current NSGC members, a lapsed member, and representing overall the diverse experiences and backgrounds of NSGC's membership. And as you'll learn during today's presentation, NSGC has made great progress since the 2020 assessment. You can see that on the dashboard. the initiatives and efforts implemented over the past few years are making an impact across multiple areas of the organization, which is really exciting. And Exeter has continued to identify additional areas of opportunity because, as we know, the biggest room in the world is the room for improvement. So this is a journey and without an end. We continue to work on it. And this is just the next important step to keep our progress moving forward. So special thanks, huge thanks to the J.E.D.I Stewardship Committee and the chairs of that committee for helping to guide and inform the assessment throughout this process. I also want to thank all the members and the board, committees, SIGs for playing such a big part in advancing our J.E.D.I action plan over the last 4 years and looking forward to doing more. We have a lot we can accomplish together. So looking forward to the next steps. And I'm always available if anyone wants to reach out. My email is simply Haverty@gmail.com. Thanks so much. And I'll hand it over to Yamna. Thanks.
Thanks, Carrie. So to get started, we wanted to review the methodology for the assessment. So looking at on the left-hand side, we'll see that the survey re-administration consisted of 635 responses out of the 3,524 members invited. And so that yields a response rate of 18.02%. And the survey duration was open from March 5th to the 25th. And then the right side, we'll see stakeholder interviews. So that as Carrie mentioned earlier, was with 15 key stakeholder interviews. And then the questions focused on J.E.D.I within NSGC and assessing NSGC's culture of inclusion and belonging. And then the comparison to the 2020 assessment, the baseline survey, stakeholder interviews, focus groups, and a policy review was included in 2020. Moving forward, we look at strengths. So this shows that scores in 8 of the 9 survey domains increased in 2024 compared to 2020. NSGC, as Audra mentioned earlier about the maturity model, has moved from a level 2 to level 3 on our DEI maturity model. And then quantitative and qualitative results show that respondents acknowledged NSGC's J.E.D.I efforts that have been conducted and implemented in the past 4 years as well. And we want to end with that NSGC implements multiple J.E.D.I initiatives ranging from policies and procedures to mentorship and financial opportunities, more in detail, which you will see as the presentation progresses. And with that, we're going to go over to the quantitative findings review, and I will hand it over to Kaeleigh.
Thank you, Yamna. I'm Kaeleigh. Lovely to be with you all, and we are going to dive into the quantitative analysis comparing the 2 surveys from 2020 and 2024. So this first slide that we're looking at is going to be comparing the response rates from our J.E.D.I organizational assessments. At the top, you have our results from 2020, which is a 14% response rate, and our results from 2024, which is an 18% response rate. I want to provide some more context on this slide. If you will notice that there is a population size difference going from 2020 to 2024. I do want to note there is some membership differences. Membership renewal does open in October. Our 2020 survey was administered in October, meaning this was the maximum point of the 2020 membership, whereas our 2024 survey was administered in March of 2024, meaning it was a different point of membership. I do want to provide a little context there, but there was an increase in a response rate, which is always what we're looking for with a comparative analysis. So this next slide is going to be illustrating our DEI index scores for both surveys. On the left-hand side, we're going to have our index score from 2020, which is a 72% or C-. And on the right-hand side, we're going to have our DEI index score from 2024, which is 76.5%, and we give that a letter grade of a C. So that does show an increase of 4.45% between the 2 surveys, which is a great increase. It's in fact the largest increase we've had in any re-administration here at Exeter. If you're looking for a specific breakdown of scores by demographic group, those are going to be located in the report. Before you dive into that, I do want to explain that the DEI index score represents an average of scores across questions on the survey and is scored out of 100. More specifics will be provided in the appendix as well as in the full report as far as a breakdown. But as far as an increase, this is great and should be celebrated. So this next slide is going to be breaking down specific domains that were in the survey. Domains are simply just groupings of questions. And those domain definitions are also going to be located in the report to go ahead and explain what types of questions are within these. So on the left-hand side of this chart, you will see listed the domains. And then on the first column will be the scores from the 2020 survey, following by the scores of the 2024 survey. All the way on the right-hand side is going to be our variance column, or simply the difference between the scores of the domain from 2020 and 2024. All the way on the left-hand side, outside of the chart, you will see some purple stars, and those indicate domains that had a statistical change in difference. 6 of the 9 domains saw statistically significant change. And if you look on the right-hand corner and the top, that is where the key lies that will allow you to decipher whether the variance is a positive change, slightly positive or negative change, or a negative change. And I did want to note that DEI familiarity was the second lowest in both 2020 and 2024. With DEI knowledge, organizational commitment, and equitable rewards and recognition at the top. With that, I want to pass it back to Yamna. And again, if you have any questions, feel free to ask us. Thank you.
Thank you, Kaeleigh. So she went over the quantitative findings. I'll be going over, along with their team members, with about the qualitative findings today. So this is looking at the overall themes, and as you can see here, we'll have the theme on the left-hand side, and then an indication of the theme being included in the 2020 or if it's in 2024 or both. So we'll see that these themes are from the stakeholder interviews as well as the open-ended questions that were present in the survey. And a full list of those questions are also in the report as well. And so looking at the themes, we see that some of the overlapping themes included better connection with NSGC leadership and expansion of leadership opportunities, improving communication, transparency, and accountability, paying attention to both diversity and inclusion, and providing more J.E.D.I resources that overlapped in both years. Looking at the themes overall in comparison to some of the organizations that we've seen as well, we see themes that directly overlapped with other organizations included the more actionable commitment, which is the top one, to J.E.D.I, or how the organizations refer, whether it's DEI, IDE, and then improving communication was another theme that overlapped with other organizations as well, increasing accountability, and then providing more DEI resources. So that shows that, you know, across kind of like the healthcare sector, or healthcare adjacent sector, those are themes that we're seeing occurring in other organizations as well, and NSGC too. And then as a note, we just wanted to reiterate that 4 out of the 6 themes overlap from 2020. And then for the last theme for being mindful of members' capacity, 2020 members specifically stated relying less on minoritized members to educate others about J.E.D.I. So that was a part of the theme this year as well, but really that overall theme was about understanding just, you know, the time and then also dedication to patient care that people have and members will have in comparison to what how they can engage or how often they can engage in J.E.D.I efforts. And then moving to the next slide, we see, so we'll have a breakdown of the theme, so theme details. We'll give examples of what NSGC has done or is currently doing, and then what NSGC can implement or continue to do regarding that theme. So when we see more actionable commitment to J.E.D.I, we see that respondents acknowledge that NSGC has implemented J.E.D.I initiatives over the last few years. Many, though, were uncertain on how effective they've been or whether the organization is truly committed to J.E.D.I, or whether it's been offering some of those initiatives in a more performative fashion. So that's something, again, to look at for how the organization has been committing. So we want to provide those examples as well to say that NSGC has incorporated J.E.D.I as a strategic pillar in the 2020 to 2024 strategic plan. NSGC board approved the J.E.D.I action plan with objective progress tracking as well. And as Madeline and Carrie mentioned earlier, that is available on the website. And then implemented policy on diversity, equity, inclusion, belonging, or the DEIB policy that was implemented in September of 2022. And then looking at the for what NSGC can continue to do or implement, that is going to be continue to track and publish updates on the J.E.D.I action plan progress via the dashboard. So that's something that we definitely want to encourage and especially show progress tracking. And then going one step further is create and sharing a proposed J.E.D.I scorecard with quantifiable metrics that track short and long-term impact of those initiatives and policies. So one can say, you know, where the progress is, and then the other would be able to note how it's being quantified. And then the second theme is better connection with NSGC leadership and expansion of leadership opportunities. Looking into details of this theme, greater diversity in leadership was noted, and then respondents also suggested a more purposeful encouragement of people of diverse backgrounds applying for leadership positions. And then due to a link, as you saw earlier in the themes, the capacity of being mindful of people's members' capacities, some suggested smaller yet meaningful ways to engage in get involved with NSGC to enhance connections between leadership and members. And then what NSGC is currently doing, the board approved a 66% reduction of the student member dues, so it's to $50, and an all access membership model to reduce cost barriers for current and potential members to join NSGC SIGs. NSGC launched the Leadership Summit for committee chairs and board of directors. And then we also want to highlight the mentorship program as well that promotes professional and social platform connecting members across different stages in their career, positions, and specialties. And then what NSGC can continue to do and implement is promote leadership development and mentorship opportunities for new and prospective genetic counselors, continue to attend career fairs and conferences each year, and then really make sure that they are partnering with HBCUs, which stands for Historically Black Colleges, Universities, as well as HSIs, which are Hispanic Serving Institutions. And then looking at improving communication, transparency, and accountability, we see that respondents wanted continued and regular and transparent communication about the organization's J.E.D.I efforts. Again, really tying into that part about the actionable commitment as well to make sure that that's clearly communicated. And then what NSGC is currently doing, integrating the J.E.D.I goals into leadership, the organizational plan and committee charges, adding the J.E.D.I spotlight to NSGC link, to provide monthly updates, and then others include disciplinary procedures, and then member feedback email established as well to really make sure that they're improving that communication between members. And then for what NSGC can continue to do, provide those monthly updates. That was something that was definitely highlighted from member feedback, that was for those who utilized that, they appreciated it and wanted to see that. So really making sure to continue to do that and use different channels or reminders. Continue to collect member feedback via surveys, whether it's after events or programs, quarterly pulse surveys, email, and then continue to communicate to members how speakers are vetted as well, and then implement J.E.D.I metrics in relation to goals. So again, that quantitative tracking as well. And then with that, I will pass it over to Lisa.
Thanks, Yamna. I'm going to take us through the next few themes. So our next theme is around paying attention to both diversity and inclusion. So, of course, diversity in the profession is important, but members also stressed that NSGC is focused on an inclusive culture for all current and future members. Respondents also want NSGC to help address barriers, particularly financial barriers, and also to reach out to lapsed members to really understand their perspectives. Okay, so NSGC has been doing some good work in this area. There have been opportunities for member conversations and connections through the Community Conversation Series that started in 2022. The board and industry partners have awarded $35,000 in annual conference scholarships in 23 and 24. And NSGC is surveying lapsed members to better understand why they have not renewed. And some things that should continue and also start to be implemented, continuing to host student outreach events, particularly in those early years in high schools and early education, to really build awareness for genetic counseling. It would be great to publish the outcomes of those outreach events and to also continue to explore additional financial support. All right, moving on. Our next theme is around providing even more J.E.D.I resources and really sort of thinking of them as advanced J.E.D.I resources, including training and professional development opportunities, workshops, conversation forums, and materials that can be particularly used in members' practices or as they're out in the world volunteering. Also, members had asked for even more attention to be paid for members who are immunocompromised or those with other disabilities, especially with regards to the annual conference. And so NSGC has been doing some good work in this area. The annual conference sessions are being hosted in a hybrid format. We're also encouraging these J.E.D.I concepts to be integrated into applicable sessions. They've incorporated a question into the education needs assessment, asking what level of topics for J.E.D.I members would like to see. There's also a J.E.D.I themed lecture series that's been re-released for CEUs at a discounted cost, and that started in 23. And we encourage NSGC to continue to find ways to incorporate CEUs into J.E.D.I educational content, considering offering a discount to international counselors, and to continue to obtain feedback from members with disabilities, and particularly those who are immunocompromised. All right, and our final theme, being mindful of members' capacity to engage in J.E.D.I efforts. So participants identified 2 barriers that members may be facing with regards to J.E.D.I efforts. Everyone is so busy in their work lives and their personal lives that they may feel like they're overworked and just don't have the time for an additional involvement. There's also a perception that members provided that perhaps J.E.D.I has become too large of a topic that's overshadowing genetic science updates that members want to see. So in this particular area, NSGC has been providing J.E.D.I resources for counselors and genomic healthcare professionals, educators, and students to access at your convenience. There is content in the annual conference program. And back in 22, the organization hired their first dedicated J.E.D.I staff member to help lead and coordinate efforts. Of course, more work should continue and start to be implemented, including really directly linking those J.E.D.I resources to research and clinical care, not just presenting topics as issues, but also providing recommended solutions for J.E.D.I issues, and also continuing to emphasize that J.E.D.I is not this separate topic, that actually it is interwoven into all aspects of genetic counseling and should be thought of that way. All right, And just a reminder that for all the details on these efforts that we highlighted and many more, to please go to nsgc.org, and you'll see the J.E.D.I action plan dashboard that's tracking these important initiatives. Now I'll pass it back to Yamna to talk you through how to read the heat maps in the report.
Thanks, Lisa. So looking at the heat maps, you'll see a heat map table in the following slide. Before we get to that, we wanted to say, we've looked at this data quite a bit, but we wanted to make sure that you all were able to understand how to read the heat map and just, utilizing that information. So the table provided in the next slide is an example of higher and lower scoring diversity dimension groups compared to NSGC's average member scores across survey domains. So a table that Kaeleigh presented earlier with the domains will have those domains with those percentages listed across the top for reference. And then what you'll see is when we're looking horizontally at the heat map, that will be to examine the demographics group's experience overall in that first column with the overall DI index, and then as well as across the 9 domains. So for example, when we're looking at the first row, you'll see 24 years old and under members had an overall positive experience. But then when you go further and look into maybe members who identified as having a disability, their overall experience was not as positive across all domains apart from 2 of those. So that will help compare, again, that individual group experience as well as looking at comparisons to other groups. And then if you read it vertically, we'll see that you're looking at the comparison across domains. So you'll see that, for example, when examining the highest scoring domain, which was the DEI knowledge, there are mostly positive experience across the different demographic groups. However, when we're looking at the lowest scoring domain, which was appreciation of individual attributes, you'll see that a notable number of them were with a negative experience. We do have a key as well that's provided that you'll see. So with that being said, looking at the heat map example, we see the key at the top. So anything with a 5% or more lower score than the average will be highlighted in red. 2 to about 4.99% is yellow, 2 to 4.99% is blue, and then 5% or higher than the average would be highlighted in green. So when we're looking at that example that I provided, you'll see, again, looking horizontally for 24 years old and under, you'll see mostly for white or yellow boxes with a blue box in there. So it shows that an overall experience was positive. And then looking at, as I mentioned earlier, for members who identify with a disability, across what domains did they report a less favorable experience. And so this is just, as we said, an example. If from the report, the other demographic groups that were included are in the report as well. I'll give everyone a moment to kind of absorb this before moving on to the maturity model. Okay, and then I'll hand it over to Lisa for the maturity model.
Thanks, Yamna. So on our next slide, this is also in the report. We wanted to share with you all the DEI maturity model that Exeter has developed. It's really meant to help our clients to understand where they are on their journey to embed DEI into their operations, into their culture. Because really what this is all about is not just a bunch of initiatives that you're doing, but it's really about how the organization is showing up day in, day out for your members and the impact that you're having on patients and the wider community. Okay. We really wanted to highlight that that this is a real strength of NSGC's, that you've come a long way since we first started working with you in that first assessment. We would have placed you somewhere in that sort of level 1, level 2 area. And at this point, we'd say very confidently that NSGC is at a level 3. So just to kind of walk you all through these different levels. Level 1 is awareness. Level 2 is conducting an assessment. Level 3 is focusing on capability building. Level 4 is actively implementing, and level 5 is that continuous quality improvement. And not only are you solidly in level 3, you're also working on some aspects of level 4. You've got a formal DEI leader that you've had since 22. There is a team within the organization, within SIGs. Also, you've got Exeter support on this work. You have a budget, you have a robust plan that you're tracking and being very transparent about. There's training that has been provided, and you've also broadened the demographic information that you're collecting for members. And we know that training is being continuously developed and provided, and that there's, of course, more work to do to cover off level 4, but we really wanted to highlight the work that you've done, and how far you've come in the last few years. All right. Now we'll move on to recommendations. I'll hand it over to Kaeleigh.
Thank you, Lisa. So we are going to go over some top 3 recommendations from our assessment for 2024. Before diving into that, I just want to emphasize that this is not a comprehensive list. All of our recommendations can be found in the report. So the first one we're going to discuss is continue to communicate with members. Articulate how J.E.D.I can be more relevant to genetic counseling roles in patient care rather than treating as a separate topic. Communicate results from member feedback collected via surveys that is not confidential. The next recommendation is leverage member feedback and measure and share the impact. This includes aligned training and education for all stakeholders, new and current NSGC staff, training for SIG leaders, training for board members, etc., and measuring the impact. Continuing to include member input to maximize the conference experience. And finally, consider providing advanced education and training topics incorporating J.E.D.I. Our final top 3 recommendation that we're going to be highlighting is create and publish J.E.D.I scorecard. This includes metrics that measure overall impact of J.E.D.I initiatives for members, staff, board, and organization-wide, as well as considering adding J.E.D.I metrics to leadership goals. Also establishing a cadence to update J.E.D.I scorecard that aligns with the J.E.D.I action plan dashboard updates. That's a lot of J.E.D.I coming out of my mouth, so I hope you understood all of that. But we wanted to highlight these top 3 recommendations. Again, the full recommendations can be found in the report. And I'll be passing it back to Yamna.
Thank you, Kaeleigh. So to Kaleigh's last point about the J.E.D.I scorecard, we wanted to just show just a proposed format of things that can be included. And again, this is dependent. This is all mock data. So none of it is actual NSGC data. It's just data points that we would offer to point out the comparison for different years. So starting from the left-hand side in the upper right-hand corner, we'll see the overall DEI index. So as surveys are administered, you can see the different increases, hopefully in score. And then I did notice a question in the chat as well related to that about, how this about 4%, 4.45% was one of the largest ones. So tying that in, yes, because we've seen other organizations have maybe like 1 or 2% increase, a 3% increase is even. And we've also seen organizations in their re-administration drop in that DEI index as well. So it's something that I hope that answers that question as well, to show that we definitely want to highlight that strength, especially at NSGC and all the efforts and initiatives that have been implemented to really show that progress, and this helps quantify it. And then looking in to the middle of the graph, we see that the ranking for satisfaction with the J.E.D.I annual conference, with the coverage of J.E.D.I at the annual conference, that's for 2023. And then again, the graph next to it on the right-hand side would be for 2024. So you can see that the scales are the same, and then see the different responses. And again, this is mock data, but just to show that if there were differences, that would help with that comparative analysis. And then lastly, we have website analytics. We definitely see that NSGC utilizes their website both for communication and for progress updates. So it would be great to know, or for members to see, how much engagement is with the website as well. And then other things include scholarship awards. As Lisa had mentioned earlier in the slides, it was, I think, about $35,000 looking at financial assistance. So we really want to make sure that we're highlighting those type of initiatives and awards. And then lastly, outreach as well. We talked about, improving that outreach and really connecting with potential genetic counselors and early on in education. So really making sure that we're highlighting that and looking at that, where events are falling, whether it's high school or college as well. And there's a couple of different ways that this data can be presented, but we just wanted to provide a proposed presentation of that. Okay. And then I understand that was a lot of information. So thank you again, everyone, for your time with this. And with that, we'll be moving into the question and answer part of the discussion today.
Thank you so much. Thank you for sharing the information with us and helping to answer a lot of our questions. There's been questions being answered in the Q&A box, but if you have other questions that you'd like us to answer in the next 10-15 minutes or so, please feel free to utilize the chat box or the Q&A box, sorry, for us to answer those as we go. I think one question, if we could pull up the slide deck again and go to slide 11, where the domain differences are listed. There was a question, and if I hope this helps, I hope this is where you were referring to. This was an anonymous question regarding the quantitative result that decreased with this table. And there was only one on the bottom that decreased that score from 2020 to 2024. The specific question I'm trying to find. Can you expand more on the quantitative result that decreased and thoughts from the qualitative data about why that may be with the appreciation of individual attributes? So I think it's helpful in this case if you have really specific questions about the difference between the years in 2020 and 2024, you can read the survey questions that were part of this domain in the survey, in the executive summary, which starts on page, I believe, 75. And you'll be able to see the types of questions that were asked, and then that can help inform your understanding of how and people answered. And you can also see in those heat maps that Yamna shared how different demographic groups responded to this particular domain in the heat maps themselves.
I agree.
Thank you. Looking at some of these other questions.
Okay.
We have a question about the recommendation focused on lapsed members and why the focus is not on the needs of current active members. So I believe this was a recommendation regarding, and Yamna, help me if I'm forgetting the exact section it's in, but
Was it improve communication or on the recommendation side itself?
I believe it might be around improving communication.
Sure.
And so as we learn to better understand why lapsed members don't renew their membership with NSGC, that's something that we've heard from other members in the past about reaching out to those lapsed members to better understand that reasoning. So we can use that to help inform the type of organization, the type of association that we are building together to be more inclusive of everyone's experiences. And so that includes asking questions like that in a lapsed member survey and reaching out to them specifically to get that feedback. We, of course, always are asking for your feedback and input throughout the year. We send out many surveys, one of which is the J.E.D.I Pulse survey, which I saw Carrie mentioned in the chat that we are doing quarterly. We had one last quarter around mentorship. This quarter, we'll be getting your input around J.E.D.I education and resources. So look out next week for that survey. But that's why it's so important to fill out those surveys. When we send out the member needs assessment, the educational needs assessment, the J.E.D.I Pulse surveys, we really do review that feedback closely with the committees, with the board, and with the executive office to use that feedback to make informed decisions about strategies and practices that we're implementing throughout NSGC.
Absolutely. And there were some of the things that we highlighted in the presentation as well. We definitely want to, always include current members as well. So that's some of the things that we said, that to continue to provide and collect that information from current members, continue to communicate, continue to have that email open for that feedback loop as well. So definitely want to acknowledge that, those initiatives and the continuation of them.
Okay, we have another question in here about if genetic counseling program faculty participation in J.E.D.I training is being considered as a metric for the scorecard or on the dashboard. This is great feedback, and it's something that we can definitely look into seeing how this fits in with NSGC's J.E.D.I strategies around recruitment and retention, and incorporating some of those metrics in the scorecard as well. And then we have another question asking, for the next surveys, can you send individual emails to members from the previous year so that you can include those who did not choose to renew their NSGC membership? This was actually a strategy that we implemented this year, where we reached out to lapsed members who did not renew their membership in 2024 to invite them to participate in a stakeholder interview. So we really were hoping to receive feedback from a lapsed member in that area about that. So that is something that we did incorporate into this year's assessment. Just going to check and see if there's anything else in the chat that we haven't been able to answer yet. Lisa wrote in the Q&A, curious how diversity dimensions are decided to be included, and if possible, to leave more open-ended to allow respondents to simply note that they consider themselves to be a member of a minoritized group, ensuring any and all dimensions of diversity are accounted for. Thank you so much for this feedback. And we, regarding the diversity dimensions, and I can let Yamna jump in if she has something else to share too. We do look at the PSS, and we match the diversity dimensions of membership based on the different demographic groups and how people respond to that part of the survey in the PSS each year. And that helps us to ensure that we're incorporating the diversity dimensions for different members. But if there are specific dimensions that we are not including that you would like to be considered, you can always reach out to us at nsgc@nsgc.org, or you can reach out to me personally. And I'd be happy to take that feedback into consideration. We want to ensure that the surveys are as inclusive as possible.
And then just a note to add to that, and Exeter team, please feel free to add to this as well. We, in our survey questions, we do have for demographics, for multiple demographics, a self-describe box as well. So they are, members or respondents are able to utilize that and fill in that text box if there's other or please self-describe available to them. So that is one way that we're definitely trying to make sure that the inclusivity is noted in the survey questions.
Another question just came in. What are the plans to address concerns that DEI training overshadows the genetic science updates? This is something that has come up in not just this assessment, but in other surveys as well that NSGC has administered. So it is something that is definitely top of mind, and something that we are considering and looking into how to better address members' needs around genetic science updates, while also incorporating J.E.D.I into really all aspects of education and programming that NSGC provides. So that is something that's very top of mind for the J.E.D.I Stewardship Committee, for NSGC leadership, and the board as well. So stay tuned. Any other questions, please feel free to type them in the Q&A box. Okay. If there are no other questions, we can wrap up. Carrie, Haverty?
Yes. Just real quick, I wanted to address one of the questions asking about recruitment efforts, which is a really important question. There's two aspects. One is just letting people know about the profession, and one is also to reach people early enough in their academic career that they'll be interested in it, and that helps diversify our workforce, of course. In terms of the second part of the question is around improving number of jobs and opportunities. There's a lot of initiatives that NSGC is working on to improve that. And this is definitely something that's factoring into our strategic planning. Remember, we're on the third year of a 3-year strategic plan. So we are in the midst of working on developing the next 3-year strategic plan. And that should be, at least a degree of it will be unveiled at the annual conference. So stay tuned, but this is definitely top of mind, and some critical aspects around that involve billing and reimbursement. So helping to make sure institutions are billing for their genetic counseling, working to get the federal bill passed, licensure in states, all of those things impact the job force. And that's a critical aspect of what NSGC as a professional organization can help do that we as individual genetic counselors can't do on our own. So it's one of the benefits of having an organization like this. So definitely lots of work going on that, with more to come, open to any and all ideas too. Thank you.
Thanks, Carrie. Any other questions that we have not gotten to yet in the Q&A? We'll be sure to follow up via email with information to answer those questions. If there are no other questions specific to the J.E.D.I organizational assessment, I definitely recommend that that you please take a look at the website and review the J.E.D.I organizational assessment executive summary that's posted there. And if you have any follow-up questions, you're welcome to reach out to me. I could put my email in the chat in case anyone would like to further discuss any of the findings from the assessment. And thank you all so much for taking the time to attend today's webinar and learn more about the findings and results from this assessment. And thank you to the Exeter team and to Carrie for presenting today as well.